Tomorrow is World Pneumonia Day, right? And we're talking about something like keeping track of it. Every breath matters. You get to hear, Mom, I'm having this feverish condition. My lungs hurt, my chest hurt. I just can't breathe properly. For toddlers, or will I say for infants, you get to see them struggle to breathe. You also hear that wheezy like kind of sound coming out from, their nostrils, their lungs. Anyway, I have a doctor in the house that really talk about this. Join me to welcome a consultant in pediatric department, and of course is a pulmonologist, right? I appreciate your coming, Dr. What again? Ovonomo Ewe. Thank you so much for coming. It's a pleasure having you join me in the studio today.
Thank you very much.
Pneumonia. That brings to mind what happened when I was very, very tender. I woke up to meet my mom crying. What happened? Your sister Queen just passed on. What happened? Pneumonia. I was like, come on, what is pneumonia and all that? Quite painful. But the sister never got to know because we were like very, very little. And I observed that some parents are even in that situation today, heartache and pain occasioned by that singular disease. Well, let us start off from the top. What is pneumonia, Doc?
Okay, thank you very much for having me. So, pneumonia simply means infection of the lungs. So that's just what it simply means. So, and you have two lungs, which is in our chest. So when you have an infection in the lungs itself, not just the respiratory tract, we say the patient has pneumonia. And it can be from different causes. It can be from a bacterial cause, it can be from a viral cause, it can be from a fungal cause. These are microorganisms which we cannot see with our own eyes. And when these things happen, the children tend to present in certain ways. The body has a mechanism of helping us prevent infection. Starting from the hair that that is in your nostrils down to the lungs. So there are certain mechanisms that help to protect the body against infection. So when all these mechanisms are breached from one way or the other, the patient may come down with what we call pneumonia, which is an infection of the lungs. Simply put.
So let's say it's like a lung kind of disease.
Exactly.
It affects the lungs only.
Only the lungs.
But how come you get to see people suffering from this particular disease have this elevated temperature? How does it relate to that?
Okay, because it's an infection. So when you have an infection, there are microorganisms. Your body tends to react, you understand? So the temperature is one way we also know that infection is ongoing. So when we are even managing the patient, we use that temperature, which is the fever, to also monitor the patient. Because it's an infection. When there's an infection, microorganisms are released, pathogens are released. So this cannot cause fever. We should not check the patient's temperature is elevated. So we also use it as a symptom, and we also use it to monitor the patient even when the patient is getting better. So we also advise parents that when your child is sick or you notice that your child has fever, don't always give paracetamol, because we as doctors, we use it. It's a very useful tool. Do you understand? Or sometimes a baby is just playing. The mother will say the child plays a lot, and the mother just wants to give paracetamol. And when your child is actually sick, you will not be able to even pick that fever. So sometimes when the children come, they're already convulsing. The mother will tell you, there was no fever, but you have been giving the child paracetamol. So that fever itself is a useful tool for us to be able to know that, yes, this child is actually sick, and we're able to pick an infection that is ongoing. And when we're also managing the patient, that fever, we also use it to check whether the temperature is coming down. So, okay, the child is getting better.
So you're saying paracetamol without parents knowing that it has this tool of masking a fever can really distort the diagnosis of doctors?
It doesn't distort our diagnosis in a way, but it makes the parents not to present early, which is one of the things we are talking about today, pneumonia. Early diagnosis, early presentation, early treatment, and prevention. So it helps the mother to be able to know that something is actually going on in my child's body. So giving the child paracetamol all the time marks that temperature. So the mother doesn't really know, because it's usually one of the first things the mother will pick, that the child's body is hot. you carry your baby, the baby is hot. You know that, oh, something is actually wrong. So we encourage mothers, don't just give paracetamol for no reason. If your child is sick, come to the hospital, let's diagnose the child and help the child.
All right. Right now, sister, I want to focus on children and the time permits will move over to adults. Now, talking about children, aside elevated temperature, vis-a-vis fever, what are other symptoms of the disease?
Okay. So other things the mother should watch out for: cough. Child may have cough, the child may have catarrh, fever, like we just said. Then fast breathing. The mother notices that the child is breathing faster than usual.
Fast breathing.
Fast breathing, faster than usual. Everybody knows how their child breathes. You now look at your child breathing, what some mothers will describe up, up. Then there's what is called difficulty with breathing. The simple way the mothers can know is that, oh, there's inward drain of the chest muscles go in and out. So those are the common symptoms that they normally present with cough, fever, catarrh, fast breathing, or difficulty with breathing. So if the mother notices all these symptoms, she should come to the hospital. And the other things, we as doctors, which we call signs, we will not be able to elicit when we examine the patient.
Now, some will be saying that my daughter, my son always sweat at night. For that reason, I should just expose him or her so that the body would not be so filled with rashes and all that. All of a sudden, bam, pneumonia. How can one really explain that?
Okay, so that's one of the reasons why we are doing this World Pneumonia Day, because it's a yearly program of awareness, creating awareness to people to understand what pneumonia is, ways of prevention and ways of treatment, and also to talk about the myths that are out there, which is what you just said now. So there's this thought that if you expose your body, breeze will enter the chest. That's what is in the common, that's what the common man thinks, which is not so. That's why we say it is an infection. It is not breeze or air, like what they will say. That's why when the patient comes, they'll say, breeze enter my child's chest. And it's a big problem because we have seen homes argue, as in couple argue, mother-in-laws fighting the
daughter-in-law.
Exactly, that I told you to cover this child's body. You don't always do it. So I always ask them, and when I go for ward round, if I see a grandmother present, I'm always happy because I get to educate her too, so that she doesn't go home and blame the
daughter-in-law.
So I use this as an example and said, this is a room. Take an example like this room now is your chest. There are only two ways air can come into this chest, into this room, either the window or the door. Your mouth is the window, your nose is the door. If I shut your nose and your mouth, are you going to breathe? And they always say no. I say, just take it that your chest wall is the wall of the room. Can air pass through that to this wall, into this room? They will say no. That's how your chest is. It's mainly through inhalation. That is, you have to breathe it in. But there are also other routes, to call it hematogenous spread, that is through the blood. But the major route for children is through inhalation. So breeze cannot come through your skin and penetrate your skin and go into your chest. It doesn't happen. So we always educate them that, I always open the child's chest and say, where is it going to pass? Where is the hole? Show me. And they'll be looking at me and be smiling. So it's just awareness, and we keep educating the mother.
So you're saying there's nothing like that about you get to hear the word of pidgin English, cold into my Peking chest. You open window, you open door. Today we no go agree and all kind of things.
That's why we keep. That's why I use that example that your chest is like a room and the chest wall is like the wall of your room. The breeze cannot penetrate. The child has to inhale it. It can't penetrate through the skin. Your skin is closed, so it's not going to penetrate. So we keep educating them that it doesn't happen that way. Is an infective process. That's why you have a fever.
So you say it could be like, breathed in by these children.
Yes.
And maybe you say right now that it's existing in the environment or what?
Because these items, there are microorganisms everywhere. You can't see them with your eyes. So there are risk factors that can predispose a child to having pneumonia. First of all, we talk about immunization. Because it's an infective process, we encourage mothers, take your children for immunization. There are some vaccines that are specifically for those organisms that will cause pneumonia. So if your child is immunized, the chances of the child having pneumonia is reduced. Even if the child has it, the chances of the child having the severe form of the disease is also reduced. Then we'll talk about exclusive breastfeeding, which we call baby friendly, because there are antibodies in the breast milk that can protect the child from infection. Then we talk about biomass fuels, using kerosene stove, using firewood and all that. Like I said, this protective mechanism that are in your airway, when the child is exposed to this smoke, gradually, those air pollutants compromise those mechanisms that can protect your airway. Then the child is now susceptible to infection. But we know these days now, the economy, we are not saying that don't use kerosene, don't use firewood, but don't do it in the presence of the children. I know somebody that was using firewood to cook inside her house. How will the child not inhale the smoke?
Inside the house?
Inside the house. The child came down with pneumonia. Then we also talk about passive smoking. Some fathers smoke, some mothers smoke. Don't do it in presence of your children if you know you cannot stop. These children keep inhaling these air pollutants and gradually.
So you're saying that if a parent smoke and the child is like, around that
Yes.
vicinity, he or she may just come down with pneumonia.
After a while, not immediately.
Okay, after a while, like an accumulative effect.
Exactly, because those air the smoke that comes out from those cigarettes causes destruction to those mechanisms in the airway that is protecting the child from infection. If you're in a house, you have a roof. The roof is protecting you from the sun and from the rain. When the roof goes up, you are going to get drenched by the rain. So that's what those those mechanisms in your airway they are trying to protect you from those organisms which are in the environment, which you cannot escape from. But your body has mechanism to protect you from them. But this inhaling of these air pollutants will cause destruction, gradual destruction of all these mechanisms, and you are susceptible to infection. Then we also have daycare attendants,
Okay.
but mothers must go to work.
Sure.
So when a child goes to daycare or goes to school, the child comes in contact with other children. This one is coughing, this one has a fever, and it's airborne, so it's going to spread because the child is coughing, this one now inhales it. So we always tell mother, if your child has symptoms, early detection, early treatment, it prevents death, because studies have shown that in a year, up to about 160 million cases of pneumonia are reported, and out of that, about 80 to 90% are seen in low and middle income countries. And in that range, about 2 million children will die. So why it's painful and why we are talking about is that it is a preventable disease.
Preventable
disease. So you can prevent it, you can prevent the disease, you can prevent the mortality. So why not talk about it? So we are coming to talk about it so that all of us can be champion of pneumonia.
All right.
You can talk about it, the government can talk about it, other authorities can talk about it, so that the people in the society are aware of it and know that it can be prevented, it can be treated
All
to
right.
prevent mortality.
Now let's take a look at other aspects. Some are saying if you expose yourself to air condition, that is likely that you're going to catch or get infected with this disease, pneumonia. How true is it?
It's not true. That's why I keep stressing the fact that it is an infection. The AC is not going to give you an infection. Do you understand? It's just like saying that means people that are staying in an environment that are very cold. Russia and the rest. That means they're not going to come out of their houses. So staying in AC is not going to give you pneumonia. Do you understand? It is an infection. That's why you have preventable ways which you can prevent with something like immunization, exclusive breastfeeding and stuff like that. So staying in AC is not going to give you pneumonia. And opening a baby's chest is obviously not going to give you pneumonia.
So it's what they touch, inhale, and that's just the major factor that give rise to pneumonia.
Mainly inhalation. Like I said, the other routes, like a child can have, you see babies that have all those kind of little boils on their body, that can have pus. So because the skin, the protective mechanism of the skin have been breached. So if infection goes into the blood, it can go to the lungs. But the most common route is inhalation. And that's why we talk about that the environment should also be clean, talk about daycare, the child coming in contact with other children, talking about overcrowding. When you have a room that you have too many people, overcrowding, this one is coughing, this one has pneumonia, and that it's going to spread easily. So these are ways of preventing it. The more you talk about it, the more you prevent it, the less cases we are going to have.
So what about the case of adults coming down with the disease pneumonia? How can an adult full-grown adults contract that kind of a disease, knowing fully well that they have tough skin, they have stronger lungs, they have, good, how will I put it now, soldiers in their bodies to fight against infections.
Well, adults can also have it. Do you understand? Overcrowding is also still there. If you are an adult and you are coming down, you are in a place, maybe you are working in a community or you have a job that they keep doing bush burning or all that, you are inhaling it now. It's still going to cause destruction of the mechanism of your airway. So it doesn't mean that because your immunity is strong, you are not going to expose yourself to things that will trigger an infection. Although they may not come down with the severe form just as common as children, because children immunity are quite low compared to adults. So that's why pneumonia, the majority of cases are seen in the under 5 compared to adults. Adults do have pneumonia. They also still have complicated cases, but not as much as children.
All right. Now let's take a look at the treatment. Is it treatable?
Of course.
If yes, how can it be treated?
Okay. So first of all, it's not, most mothers don't want to go to the hospital because they think, once I go to the hospital, they're going to admit my child. It's not all cases are admitted. The thing is that early detection, once you come early, the child can be given syrup or tablet and you go home. Because pneumonia is classified into the non-severe cases. And the severe cases, we have criteria for doing that. So if it's not severe, but the child has pneumonia and the child doesn't require oxygen and other parameters are okay, you can give the child antibiotics, oral, and the child goes home. But if the child if it's very severe and we check the oxygen level and it's low, that child has to be admitted and you provide oxygen support for that child.
Oxygen support, respiratory support.
Yes, respiratory support. You have to give the child oxygen because the child can't breathe. You don't want the child to die, so you have to give the child oxygen. Then you give antibiotics. So usually for that kind of case, we have to put in a cannula into the vein and give intravenous antibiotics. Sometimes they're unable to eat, they have to give IV fluid. For those that can eat, we encourage them to eat, but depending on how they are breathing, maybe the breathing is so bad, some of them may not be able to tolerate food. You put them on IV fluid, intravenous fluid, that is drip, or you not give them, for some of them, they can eat. And it can get so bad in the sense that when you have real complications, sometimes pus or fluid can gather in the lungs. Yes, that you have to pass a pipe and you have to extract it because you don't want this child to die.
So these are severe cases of pneumonia.
Severe cases of pneumonia, and we have them every week.
Every week.
UBTH. There's no week we don't have cases admitted of pneumonia, and it's painful because it is preventable. So if we talk about it, we have less cases. Even if we have the cases, we're not going to have the severe cases which we are seeing because children die of it every day. And it's something that we should talk about.
All right. Now, talking about preventive measures, apart from the drugs, the antibiotics, after all, prevention, they say, is better than cure. So what are the preventive measures?
The major preventive measure of pneumonia is immunization. So once you have a baby, please enroll the baby in an immunization center and immunize your children. It's free.
No, against pneumonia,
yes,
they have that.
Most of those vaccines, they contain some of the vaccines are targeted to some organisms that can cause pneumonia. So your child gets vaccinated. The child has a higher chance of not acquiring the infection. Even if the child comes down with the infection, the child may not have the severe form of the disease. Do you understand? So immunization is paramount. We have seen, and we know we have this culture. We have seen mothers. I had a patient once who said, my pastor said we should not take drugs. And she did not immunize her children. And the child came down with very severe illness. Wow. So you have cultural belief, you have religious belief that affects people from taking immunization. The another way is through exclusive breastfeeding, which we call baby friendly. Breast milk is cheap. Well, so
baby friendly.
Baby friendly.
But some mothers are scared of that, like 6 months, 1 year.
It's 6 months. It's 6 months. It's free. You're not buying anything. A cup of
something like this baby just want me to be eating and eating and eating. I just start adding weight all because I want to be friendly.
It has protective mechanism. It has antibodies in the breast milk that you can't get in formula that can protect the baby against some diseases. So, and you have I asked my mother this day, how much is a can of milk? They say that 8,000 to 9,000. If you have a baby that really is, you're going to get like 3 cups in a week.
True.
So most times the mothers don't mix the food appropriately, so the baby is not being well fed. Do you understand? So the baby gets malnourished and the baby gets exposed to infection.
All right, all right. Well, it's been wonderful talking to you about this aspect of pneumonia because I was like, tomorrow with the pneumonia day, I remember my sister, well, were very, very tender. I was like, mom was crying. I was like, what? Pneumonia? I was like, what is that? There was like, tears and tears and tears. And I got to realize it was like a long disease, a long thing. Well, with me here in the studio has been Dr. Ewe. She is a consultant, pediatrician, pulmonologist, UBTH. I hope when I invite you next time for other talk to make us available. Because kids right now are everything gradually towards the dry season, and that comes with a lot of challenges for our children. So not to worry, I'm still going to extend the invitation to you to talk more about taking care of our children during Harmattan season. Thank you once more, Doc.
Thanks
Appreciate your coming.
Thank you very much.
All right. We'll do this again next week, Monday. Just stay healthy. Bye for now.